Okay. Welcome, everyone, and thank you for joining us for today's webinar, Mental Health and Wellbeing and the Psychosocial Dimensions of Peacebuilding, hosted by the Red Cross Red Crescent Research Network. My name is Yasin Duman, and I'm a research specialist at the MHPSS Hub. I'll be moderating today's session. It's a pleasure to have such a diverse group of practitioners, researchers, and colleagues with us as we explore one of the most pressing and often overlooked questions in our field: how mental health and psychosocial support shape and are shaped by peace-building processes and programs. Across conflict-affected settings, we see again and again that cycles of violence, social division, and collective trauma are not only political challenges, but deeply psychosocial ones. Yet the integration of mental health and psychosocial support into peace-building practice remains uneven or not recognized enough, the importance of such an integration. And today we aim to unpack this gap and consider what becomes possible when psychosocial perspectives are placed at the center of efforts to prevent violence, support mediation, and strengthen social cohesion. So to guide this conversation, we are joined by two leading voices in the field whose work has significantly shaped the emerging field of psychosocial peacebuilding. We have Dr. Katrien Hertog with us, Director of Peacebuilding Programs at the International Association for Human Values, who brings 25 years of experience as a peacebuilding researcher, trainer, and practitioner. Her work spans trauma relief, preventing violent extremism, mediation support, and large-scale resilience initiatives across Europe, the Middle East, and North Caucasia. She is the author of The Complex Reality of Religious Peacebuilding and Psychosocial Peacebuilding, a guide into the heart of sustainable peace, and a more recent work, Psychosocial Peacebuilding, a guide into the heart of sustainable peace. We also have Dr. Eric Fresco from University College London, who is a political scientist and global health researcher whose work examines the psychosocial dimensions of conflict, marginalization, and peace processes, drawing on community and political psychology, particularly psychology, participatory action research, and narrative and ethnographic methods. His research illuminates how relationship between social groups and the mental health impacts of violence shape the possibilities of peace. He is the co-author of Reconstructing Theory in Mental Health and Psychosocial Support and Peacebuilding Towards an Integrated Model for Psychosocial Peacebuilding. Together, our speakers will help us explore key questions, including how do mental health and psychosocial support influence the effectiveness and sustainability of peacebuilding efforts? What roles do community-based and participatory approaches play in addressing trauma and social division? And how can integrating psychosocial perspectives strengthen programs aimed at preventing violence or building social cohesion? We are glad to have you all with us, and we look forward to a rich and thoughtful discussion. I'll first give the floor to Dr. Hertog, and then we will hear Dr. Rig, and then we will move into the Q&A session. Each of our speakers will have 25 minutes for their presentations and speeches. Once this is done altogether, we will then open the floor for the Q&A. Dr. Hertog, the floor is yours, please.
Yes. Hello. Good morning, afternoon, evening, everyone. Thank you, Yasin, for the invitation and the Red Cross, Red Crescent movement around the world, especially those interested in mental health and psychosocial support. It's a pleasure to be here. I will share, of course, what I figured out in the last 25 years of my life. Since the moment I actually wanted to find a switch in humanity to make the world more peaceful. This has been the quest throughout my life. I studied peace building, but at that time, which is long ago, there was no attention for the human being in peace building. Then I worked for different peace-building organizations, and either they were very strategic, very focused on system change, structural change, and not very human, not very connecting, or they were very human, very connecting, but not very strategic and not very impactful. So I kept looking, and then I came across the trainings of the International Association for Human Values and the Art of Living Foundation. And personally, I experienced such an incredible peace during those trainings I didn't even know existed. And when they said we are applying this in conflict zones, war zones, and prisons, I thought, maybe here is the, some possibility of a switch for humanity. So I quickly became a trainer and became the director for the Peacebuilding Programs for the International Association for Human Values. And I started developing, researching, practicing, implementing, approach that could be called psychosocial peacebuilding. But it was also in parallel with developments in the peacebuilding field. Like, as many of you know, there was the whole movement towards more local peacebuilding, more grassroots initiatives, the discoveries of neuroscience, the attention for psychosocial dimensions in ethnic conflicts. There were so many new developments in the peacebuilding field that also brought up this attention. And of course, lately, it is the whole attention for mental health and psychosocial support in peacebuilding. So different strands came together, and I would like to present to you today the framework of psychosocial peacebuilding that I developed and that I've written about just in this recently published book, but also the practice of psychosocial peacebuilding. And I really look forward to your informed observations, suggestions, and comments, because we are all kind of developing this field, from so many different angles. So, so the first question is, what is psychosocial peacebuilding? How to define it? Basically, we could say that it looks at how psychosocial factors influence conflict and peacebuilding dynamics. This can be positively and negatively. Yeah? And at the same time, how psychosocial factors themselves are impacted positively or negatively by conflict and peace dynamics. So it is an approach or a practice that goes through all the stages of conflict. Yeah, from prevention to rehabilitation, reintegration, reconstruction, at all the levels, from individual to global, in all the sectors of society and throughout the project cycle. So this resonates with a quite broad definition or understanding of peace building. So it is human-centered because in the end it's human beings who shape, undergo, experience, and respond to the dynamics of conflict and violence around them. It's not just addressing the psychosocial consequences of conflict and violence, it's also strengthening the resources for peace building. Yeah? And basically it is touching upon the humanity of all of us. So without escaping or evading the complicated aspects of our human nature. Yeah? So it could be like, about the meaning of life, about the deepest wounds that we carry, about fundamental identities that are passed on from generation to generation. It could be about the values that we cherish. It could be about long-term interpersonal conflicts. And so it's really about what is especially profound, meaningful, and relevant to our life. So somehow the slide is stuck. Let's see. Stop. So if we talk about psychosocial factors, of course, this can be, it's an ocean of possibilities. Yeah, I try to, I suggest here some way to structure them. The more biopsychological, the more existential, spiritual, more socio-cultural, and more psychosocial. So it's a whole range, going from the physiology to emotions, to mindsets, to attitudes, to values, and so on and so on, everything related to relationships. So when it comes to implementing psychosocial peace building, we could look, for example, at 3 levels. Of course, there is the intrapersonal transformation, which is the cornerstone and the foundation. This is, for example, our nervous system, to dissolve the trauma reactions in the nervous system, or to calm our mind so that we actually perceive clearly. Many times our mind is so cluttered and stressed, we don't even perceive the reality which we are going to intervene in. It's about expanding our identity, having the experience and the feeling that we have multiple identities, not just one which is triggered by certain conflict situations. These are just some examples. The second level is then more interpersonal and intergroup transformation. This is about cohesion, about when a conflict escalates, how can we intervene, how can we prevent, how can we manage this, the important role of awareness, of skills. What do we do with the narratives, one-sided narratives, biased narratives of conflict? It's about cultivating non-violence, sharing human values, creating a culture of peace. Yes, so these are all aspects that, for example, on the interpersonal level. And structural, we can also see that there are psychosocial dimensions that influence the way we create systems and structures in society, which are either peace-promoting or not. So, for example, the justice system, but also education and health systems. To what extent do they really foster well-being and excellence in all population groups? It's also about reintegrating armed actors and so on. So these are just some examples. And then to differentiate this a little bit from the focus on the integration of MHPSS in peace building, now I'm going to put it a little bit in a caricature way, because there's so many people and organizations engaged in MHPSS in peace building and in so many different ways. So this is just like a general outline, but there are many exceptions to this. But somehow I want to differentiate a little bit the two approaches. So MHPSS in peace building is, of course, focused on how to integrate both fields. But actually, psychosocial peace building is already integrated to begin with. So that is a very different perspective and very different way of operation. Psychosocial peace building works with minds and mindsets in general, not just with mental health or well-being. So it's not just with the challenges or the problems, it's actually also with the potential, the whole of the human being and the potential. And so it's not just psychosocial support, but also psychosocial potential, right? So not just deficiency, but also empowerment. And how to create excellence also in human beings. As I mentioned, it's for all the stages of peace building, and the interaction between micro and macro levels is already intrinsically recognized. Yes? So this some of the challenges with integrating MHPSS and peace building, it's about micro and macro levels, internal and external factors. But with psychosocial peace building, it's kind of, it's recognized that everything is connected anyway. So that's a different perspective, and that's also what makes it easily accessible. And there's much less challenge of stigma, etc. As I said, this is a broad characterization, but of course, this does not cover everybody who works in both fields. So I want to present the model of psychosocial peace building that I am most familiar with, which is the one of IHV and Art of Living. They are international NGOs working in 186 countries since 45 years. And their focus and expertise is to prevent and break the cycles of violence, restore mental health and well-being, and create cultures of peace. So the idea is to work with the mindsets, the attitudes, well-being and behavior of everybody who is affected or involved in conflict and violence. So that means on all the sides of conflict. And through this, they actually lay a psychosocial foundation in all these actors on which other peace and development efforts can develop and really take root and become sustainable. And in that way, the aim is to increase the impact of peace-building efforts worldwide. as a foundation. So some examples to understand how it works for different target groups. Of course, there is stress and trauma relief, but also work with armed groups for their integration in society. There's also direct interventions in peace processes, such as with the FARC leadership, when they actually declared adherence to the Gandhian principles of non-violence at the moment when the peace negotiations were really at risk. We work a lot in prisons to break the cycle of violence for hundreds of thousands of offenders in more than 60 countries. Also, you work with the gangs in Latin America, but also in Denmark. Then we work with war-affected children and their families. For example, in the Middle East, we also work with war veterans and PTSD symptoms. We worked on youth and women empowerment in Iraq consistently, on reconciliation, violence prevention. So these are a few of the examples around the world where psychosocial peacebuilding has been implemented in different ways. So the core, as mentioned before, is intrapersonal transformation. And this is also on different levels, from the basic physical level to the mental, emotional, behavior, identity, and deeply existential levels. So when, for example, the trust in humanity is shaken, the trust in the universe, the whole questioning about the meaning of life, and connection with oneself, with the universe, with people around, with the world. So deeply existential and, basically very physical as well. So what makes the approach also very effective is that it integrates advanced breathing techniques which are connected to the autonomous nervous system. So we know that under stress, the autonomous nervous system reacts and puts our whole system in a fight, flee, freeze state, either hypo or hyperactive. And in that state, it's more the primitive old parts of the brain which dominate and more instinctive reactions. Normally, this state of high stress or even trauma calms down physiologically and psychologically, but many times it does not, especially in times of chronic stress and prolonged crisis. So here we can use the breath because the breath is part of the autonomous nervous system. So through the breath, we can restore the homeostasis, relax the whole nervous system, and actually also activate, which is very interesting, the higher brain function. So that even when we are under stress, even when there is crisis, we still can access decision-making, access emotional regulation, access capacity of problem solving and peaceful solutions. While otherwise we would go into the older instinctive part of the brain automatically, actually we can rewire the whole system in such a way that the nervous system becomes much stronger and able to feel peaceful and respond peacefully, even when under stress. And this is, for example, the feedback that we get from most of the offenders who are in prison when they do our programs. Most of the time they say, oh, now I can think before I act. While before they were caught up in vicious cycles of, aggression, depression, reaction. Now there is a space in between. Physiologically, they're able to think and pause and then respond instead of react. And that's why this dimension is so crucial, because we are actually laying the physiological possibility for people to be peaceful. So there's quite some research on the effectiveness of not just these breathing techniques, but different methodologies and tools that are used in the IHV model for peace building. So we are now looking at the intrapersonal transformation physiologically and psychologically. So it has, significant reductions in depression, anxiety, PTSD, improvement in sleep, but even there is an impact on the genetic expression. So that shows how deep intrapersonal transformation can be and can go with physiological techniques. There's also a very interesting research on the brain waves, that you can have a very alert and still calm state of mind, by practicing such techniques. So I want to show that it's not just mental health and psychosocial support in the narrow definition that is supported, but also important peace indicators such as social connectedness and positive emotions. This study is from Yale University. This study is on the effect techniques for people from Ukraine, where we can see that even after a very, very short workshop, which is like 2 times 1.5 hour, people like generally 80 to 90% of the participants experience improvements on very important indicators of psychosocial well-being. Also clarity of mind and anger, irritability, etc. And I want to share that also for peace builders, or people working in crisis zones, humanitarian people, and here in this case, medical personnel during the height of the COVID pandemic, they also integrated these techniques. And this is also an important study that was done and published, where it says not just the stress levels went down, but also the capacity to perform the job in the hospital and the relationships with other people. Also in the prisons, we also have quite some statistics. So here we see the intrapersonal, the different levels of a person interact, of course, with the society. Yeah, so these 7 levels, they interact with the society and different levels around us. You can see here up to the global level. So how we perceive the world is very different depending on how we feel inside, and how we act into the world is also very different depending on how we are inside. And it's a mutual interaction. So also same with the different sectors of society, our interaction, how we are affected, what influence we have on the outside world, positive or negative, is all also interdependent to this intrapersonal state. So that is a little bit the model of psychosocial peace building. And an example of a psychosocial peace building project was in Lebanon and Jordan, where we worked with the youth who were affected by conflict, war, violence, and trauma, both from Syria, Jordan, and Lebanon. And while initially they were affected, they were depressed, they were aggressive, we identified the youth most at risk, and also at risk of recruitment in armed groups. So really the most vulnerable and at risk groups, and we accompanied them with many different programs over 2 years, period of 2 years, to really empower them as agents of change. So instead of being affected, they turned into peace ambassadors who then designed projects to address the factors of conflict and violence in their lives, in their schools, in the refugee camps, on the street, in their houses. And so they turned the circle around, and actually from being negatively affected, they started making a positive impact in society, reaching more than 100,000 people through different peace building projects. And this was also the case study that many of you know was included in the IC guidelines for MHPSS in peace building. So just to make the link again between the personal intrapersonal transformation and peace building impact, there are some examples like the drop in recidivism in the prisons. Yeah, so 60% less people return to prison after doing a comprehensive program. Yeah, are also the reactivity of the police in Brazil. It went down with 55% less shootings that were unnecessary. The violence in the prisons goes down, the violence in schools is going down, aggression, etc. Of course, research is still quite limited, no, to make this link, but much more is needed. Okay, I think I already covered most of it. So there are different programs. Like I said, it's not just one program that fixes it all. It's tailored to different target groups. There's different timings. There are different techniques. And it, as we said, it's applicable for all population groups. So regardless of age or regardless of profession or on which side of the conflict we are or what we have experienced. So what is very important from my point of view is that psychosocial peace building is very human, it's very effective, and it's strategic. Yeah, it's not just something soft on the side or some add-on that we can choose to integrate or not. It's actually essential. So I want to also give credit to the founder of IHV, Gurudev Sri Ravi Shankar. He's one of the most renowned peacemakers, humanitarians in today's world. And he very beautifully said that a violence-free society, a disease-free body, a stress-free mind, inhibition-free intellect, trauma-free memory, and a sorrow-free soul is the birthright of every individual. And that's also the mission we are helping to promote for everybody, as many people as possible around the world. And so we have created also training in psychosocial peace building, 3 parts, the self and professional care, developing our full potential as a peace builder, and integrating the psychosocial factors in programming for increased impact. So whoever wants to develop, psychosocial peace building, we can train, we can learn together how to do this. You can read more in the book that I just published. It has a conceptual framework of psychosocial peace building, lots of case studies, lots of examples, scientific insights, and also actually exercises. It also has 1 chapter on how to design a psychosocial peace building project. And I think that's it. And I hope I am in the time slot. So for more information, feel free to connect.
Thank you so much, Dr. Hertog. That was really helpful and very timely. We will come back to you probably with some comments and questions in the Q&A session.